So tonight I am delighted to invite a friend and a colleague. Dr. Peg Maas, DPT, works at Swedish Medical Center and is a clinical faculty member at the University of Washington and a clinical lecturer at University of Puget Sound. In her clinical work, she treats patients of all ages and genders with a broad spectrum of pelvic floor diagnoses. She tries to set everyone she sees at ease so they feel comfortable asking the questions they hope to ask and can learn what they need to learn to reach their goals. And I want to say I've known Peg for many years, and it is wonderful to be able to tap into resources. We all have resources we've known. Just think of all of your friends as resources. That's how I go about my life. Like, everybody's a resource for something. So please, what Peg's going to do is she's going to take you through her slideshow. We'll talk briefly, we'll take questions, and hopefully we'll have a lively opportunity to talk about this topic. So please join me in welcoming Dr. Peg Maas.
Rebecca. Thanks, Rebecca. Do you want me to, shall I just start here? Yeah, okay. We'll just, hi everybody. Hi everybody. It's hard to see in the bright lights. I'm just gonna, this is a fairly formal dynamic here, but I'm kind of a casual person, so I'm going to think of this as being somewhat of a workshop-y type experience, ideally. And so the slide you see there, these are carrots that I harvested one year, a couple years ago, and my daughter, who was with me as I put them down on the counter and washed them, looked at them side by side and said, "Oh, Mom, even your carrots are manifest what you do professionally." So it's true. I love what I do. And I'm so glad you all are here, because this is a subject I'd love to talk about. Rebecca kind of depicted what I do. I'm a physical therapist. I never thought I was going to be a pelvic health physical therapist. That's not what I thought I was going to do when I grew up, but that's the direction that my professional life has taken me. And I work with all ages and all genders on matters that pertain to pelvic floor muscles and pelvic health. And so I want to share some of what I do with you tonight and teach you some skills that I hope will be helpful. So this is a favorite cartoon of mine from the New Yorker. The provider is saying, "In a case of this kind, Mrs. Hall, our first concern is to persuade the patient he's a stalagmite." Obviously, he thinks he's a stalactite. And I think of this having to do with the fact that people often hold beliefs that influence their lives, and sometimes they're inaccurate, and that leads to problems. And I feel like pelvic health, especially because people are uncomfortable with the subject, because people are embarrassed, they get their information from unreliable sources, and they hold fast to that information, and sometimes it's to their own detriment. And so my passion is helping to set people straight about things, trying to make it comfortable. And so to that end, I would like this to be a time that you bring your curiosity and maybe your playfulness to this topic, and I'm going to teach you some things and invite you to try and experience some things so that you leave here tonight with some skills and understanding that you didn't arrive with. It's an opportunity to learn. Interrupt me if I have said something that you don't understand or you want to take issue with. But let's start. First things first. If you are sitting, wherever you are, hello people who are at home, if you are sitting in a chair or on a couch or whatever, I'm going to invite you to put both feet down and imagine that you are in an audience with the Queen, and she is rather disapproving and unfriendly and formal, and it's not an entirely comfortable situation. And as you are talking with her, you realize that you are about to pass gas, or maybe that you need to pee badly. And so I want you to just think, what would you do that is stealthy enough not to incur her disapproval, but that would stop you from making an undignified sound or an undignified deposit in the chair? So just feel like, what what would help you out in that moment without it looking like you are crossing your eyes and scrunching up your face, etc. Ideally, you have just identified your pelvic floor muscles. So you may also have identified your eyebrows, your toe curling muscles, your abdominal muscles, your buttock muscles. Sometimes if you use your glute muscles or your gluteal muscles, it looks like you're riding a horse when you clench your glutes. But what we want is just those muscles. That's what we're talking about tonight, is those. And here's where those muscles are located. If you travel up the back of your leg and the inside of your leg, you come to a bony prominence called the ischial tuberosity. And between one ischial tuberosity and the other ischial tuberosity are these muscles called your pelvic floor muscles, and everybody has them. Kudos and shout out to my friend Rue Maya Oliver, who is a physician and also a brilliant artist, and made these, which I use every day and I love. And they're designed so that I can show them on an iPad. I can enlarge them and all the parts are labeled, but it's a lovely demonstration of where your pelvic floor muscles are. I'm not going to go into the anatomy of them, but I just want you to know where they are. And so pelvic floor muscles are unsung heroes, I believe. When they go awry, when they are dysfunctional, problematic, we get all kinds of problems. And I won't go through these line item, but I want you to just be aware that if you see yourself in some of these problems, this could be a pelvic floor issue, and we're gonna talk through a few key things tonight that pertain to these. So what pelvic floor muscles do is support the internal organs. They're like the bottom of the bowl at the bottom of your pelvis. They respond to abdominal wall pressures. When you cough, when you sneeze, when you get out of a chair, we hope your pelvic floor muscles are going to respond to that pressure and ramp up and help you. They are your core. When people talk these days about core muscle exercises, it frustrates me a little bit because oftentimes they use core synonymously with abdominals, and core is intended to mean much more than that. It's intended to mean your abdominal muscles plus your back muscles plus your diaphragm above and your pelvic floor muscles below. So pelvic floor muscles doing the right thing will tighten to control the timing of going to the bathroom, but relax once you get to the place where I was going to say the toilet, but it might be the bushes in the woods if you're a hiker and a camper. And they are an interconnected part of so many systems in our body, and pelvic floor muscles are very responsive to many kinds of input. People who have a great deal of stress in their lives often have really amped up pelvic floors. If we are under emotional stress, if we're fearful in situations where we feel unsafe. In fact, I've come recently to think when people say, I'm holding it together, if you say, how are you? I'm holding it together. I now think really that's them really representing that their pelvic floor is clenched and holding together. But a pelvic floor, if you have pain, if you have hemorrhoids, if you have just delivered a baby vaginally, or you fell and landed on your rear end, your pelvic floor may be clenching in response to local pain. So there's lots of things that influence a pelvic floor. The way I describe a pelvic floor to the people that I work with, day in and day out, as I describe the volume knob, and the fact that ideally a pelvic floor can go down to 0 on the volume knob when you are going to the toilet. It can go up to 10 when you cough or sneeze or you're carrying 50 pounds of potting soil. And the rest of the time, it fluctuates according to whatever pressure is required of it. There are some people who have a resting frown face in the world, and I think there are some people who have a resting tension in their pelvic floor that is really problematic. So you know those people who walk around with a furrowed brow, they have the benefit of somebody saying to them, "You look worried," or catching sight of themselves in the mirror and seeing that maybe they look concerned. But a pelvic floor can be amped up with a great deal of tension without you knowing it or getting any feedback about it, and it can wreak havoc. So we want to be aware both of how to tense a pelvic floor, but also how to relax the pelvic floor and have a pelvic floor that can be competent. As a physical therapist, I look at patterns of holding when people come in, and I'm looking at the way they stand or the way they are lying. And oftentimes people who hold their abdominal muscles very tightly and there's no excursion when they breathe, also have a tight pelvic floor, or a pelvic floor that's actually bulging under the pressure. Can go either way. You know those, do you remember those dolls that you squeeze and the eyes and the ears pop out? I think sometimes if your abdominal muscles are really tense, your pelvic floor can be responding that way. But also sometimes we see people who stand with their buttocks really clenched, and oftentimes those are people whose pelvic floor is in overdrive. And sometimes people who sit really slumped are tensing their pelvic floor. So I look for clues, and if you recognize yourself in any of these, that might be an indication of what's going on for you. So right now, let's start playing with this a little bit, because why not? So what I want to make sure that you understand is that I'm saying in the course of daily life, moment to moment, pelvic floor muscles need to be adept at ramping up or down, depending upon what you need from them. And the thing is, pelvic floor muscles need not only to be strong, but they need to be skillful. And they need to be not overactive. They need to not be droopy. I think it's sort of like the basset hound face. We don't want a pelvic floor that's like a basset hound. So as you're sitting there, go back to that idea of the queen, the unfriendly queen, and see if you can feel yourself slowly turn your pelvic floor up. And the way we do that, there's various commands that help people. I think having an image works. So I'm told that in Germany they tell women to imagine, or people with a vagina to imagine, that they are picking grapes with their labia. In some parts of the world they say imagine that your genitals are like a sea anemone closing. And so there's that closure. If you are somebody who has a penis, the most effective image, there's an Australian researcher whose name is Paula Hodges, who's very funny and very Australian, and he did a lot of research with real-time ultrasound, which gives you an image of what's happening with muscles. And he found that the most effective cue for people with a penis is to say, imagine that you are shortening your penis. And then, because he's Australian and has a slightly raunchy sense of humor, he says, but blokes don't want to be told to shorten their penis, so just tell them to pull the turtle's head into the shell. So if that is your anatomy and you don't want to think about shortening, but you want to think about pulling the turtle's head into the shell, that's a fine way to do that. So as you're sitting here, I want you to just see if you can imagine the volume knob, and you take any of those images that might work for you, and you crank up the tension in that muscle, and then you feel it relax. Now, what's interesting about this, and I invite you to try this whether you're at home or here, is how is it different in different positions? And I would suggest, if you feel able and interested, you can stand up and see whether doing it in standing feels different to you from doing it seated. So go ahead and stand if you wish, and try the same thing and think, does it feel different to contract and release in standing? Another thing that's interesting that we can do here is in a clinic, I'll have people get down on their hands and knees. If you want to get on your hands and knees here, you can do that. Or if that doesn't appeal to you, you can get a similar effect by just resting your elbows on the back of a chair and just think, okay, so there, does it feel different to contract and relax? And just, make note of it yourself, because what we want is the optimal exercise, and we'll get back to the exercise in a little bit, is to do what you are able to perform with good form, and a certain amount of challenge. We'll talk through kind of the perfect thing to do. But I'm going to go back to just the educational piece of this for a moment and address the fact that there's a lot of commonly held beliefs about pelvic floor function, and I want to just address some of those. It is not normal to leak. It's common, but we even have it in our vernacular, right? I laughed so hard I peed my pants, or I just got so scared I peed all over myself, or whatever. So it's in the vernacular. It's not normal to leak. It's common, but it's not normal. It's not normal for sexual intercourse to be painful for anybody. Way too many people that I talk to when I say, do you have pain with sex, will say just the normal amount, or just the usual amount, or of course it's like, that is not normal. That can be a sign there's something up with your pelvic floor. Pelvic floor issues are not uniquely the domain of postpartum people and old people. I see many people of all ages who have pelvic floor issues. I see a lot of people who say, I can't believe this is happening to me. I'm not even old yet. And in truth, I see teenagers, I see young adults. I see lots of people who've never had a baby. So it can happen to anybody because everybody's got a pelvic floor. Dr. Kegel was the person whose name went to the exercise of tightening and releasing your pelvic floor. I don't tend to use that term when I talk to people about pelvic floor exercise because 65% of study was done with women. 65% of women, when they were told to do a Kegel, did something that was not at all a Kegel. They tightened their buttocks or they bared down or whatever. So lots of people have learned to do Kegels, maybe correctly, maybe incorrectly, and some people do dozens and dozens and dozens a day because they think that's going to help them, and that is not necessarily the answer. Not everybody needs that. In fact, some people need not to do that. And as I said before, core exercise is not synonymous with abdominal exercise. So what I want to do is take you through a couple of categories of arenas where people have pelvic floor, where their pelvic floor might be at play. And the first one is urinary incontinence, which is what a lot of people experience. And I want to start by saying there is no science behind how much you should drink. If you're on a medication that requires you to have a certain number of ounces of fluid a day, so be it. But when I ask most people, what do you drink? The first answer I often get is, I know, not enough. I know I should drink more. And I will never say that to people because we don't know how much people need to drink. We know that you need to drink more if you are sweating, if you talk a lot of the day and you lose your fluid that way. What people should do is drink when they're thirsty. So there is not you need to drink this much fluid a day. There's quite an interesting history about it that has to do with the bottled water industry encouraging people. But so let me tell you what the bladder does. The bladder fills and then ejects, like a balloon being inflated, and then it deflates. There is no effort that should be involved in letting your urine go, except just that the pelvic floor relaxes. And so what happens with a bladder is that it fills, and when it's either full or irritated, or both, it sends you a message that it wants to be emptied. And when the bladder contracts, it sends a signal to the spinal cord to relax your pelvic floor muscles, and that will release urine. When you're with a baby, you don't know when a baby pees, because babies aren't straining to pee. They strain to poop, but they don't strain to pee. So what I was going to say is, so if you don't relax your pelvic floor completely, your bladder doesn't have a green light and it might not empty all the way. And so that can be a source of problem for bladders. But people who have incontinence, the way we describe incontinence is either stress incontinence or urge incontinence or functional incontinence. There's a couple other types, but those are the main ones. So stress incontinence is if you leak when you cough or you sneeze or you jump or you run. And that is most commonly, it's a strength issue. And so we want to strengthen the pelvic floor of people who have stress incontinence. And that's those exercises that we were talking. I'll talk a little bit more about those in a couple of minutes. People who feel their bladder start to release urine when they get home, they're just putting the key in the door, and all of a sudden they're like, oh my gosh, the urine's starting. We call that urge incontinence. That might be the same thing as just any time that you have to go so badly, and darn it, it starts before you get to the toilet. That's urge incontinence. Sometimes that's a result of an irritated bladder. If you are somebody like so many people in Seattle who drink multiple cups of coffee a day and your bladder is sensitive to it, not everybody's bladder is, but some people's bladder is sensitive to it, that can give people urge incontinence because it's sort of like soap in your eye. When your bladder wants to get rid of it, it just wants to get rid of it now. The most common irritants are caffeine, bubbles, and artificial sweetener, but other people have other things, and not everybody's sensitive to all those things. The thing with urge incontinence is that people who have urge incontinence are so much in a hurry to get to the toilet that sometimes they start pressing with their tummy because they're in so much panic. Their abdominal muscles start to fire. And actually, counterintuitively, if you stop and tighten your pelvic floor, your bladder will get a signal to wait 2 minutes. That's what kids are doing when they do the potty dance. When they cross their legs and bounce up and down, and you know they have to pee, and you tell them that it's time to go to the bathroom, and then they mysteriously and magically don't seem to need to for a couple minutes, and then it starts up again. That's what they're doing, is they're contracting their pelvic floor and buying some time. So as adults, that can be a handy thing. If you arrive home and you're walking to the front door and you're thinking, this bladder is releasing right now, if you stop and tighten your pelvic floor, you can get the rest of the way there. So that's a few bladder things. I could obviously talk this whole time about bladders, but I won't. Let's talk quickly about constipation. So constipation is a big thing for us, especially these days, and I think especially in the Western world. Part of it is the position that we go to the bathroom in. But you probably all know that key to addressing constipation is enough fiber and exercise and to some degree fluid. The way that so all constipation is not pelvic floor. It can be things that have to do with your digestive process. But people who have chronic tension in their pelvic floor muscles tend to have a hard time letting their bowels move. And there are some people whose coordination of their abdominal muscles and their pelvic floor muscles is off. So when they press a little bit with their abdominal muscles, they also tighten their pelvic floor, and it's a little bit trying to get toothpaste out from the toothpaste tube with the cap on. You can't do that. And so pelvic floor therapists can help with the coordination. But there's a couple tips that you can do without the help of a physical therapist. And one of them is positioning. The squatty potty is really, truly a good thing. And the reason for that is what my images there might help you with is that when we are sitting or standing, there's a muscle that pulls the rectal area closed. And that only releases when we sit in a squatting position. If your knees are higher than your hips, it gives a direct line for your bowels to empty. So it's kind of a problematic that our toilet seats are getting higher and higher, that as we get older, oftentimes you're offered a raised toilet seat so that it's not so hard to get off the toilet, but what it does is it makes it harder to empty your bowels. So it doesn't have to be specifically the product that's called a squatty potty. Squatty potty, I should have put a picture in. Squatty potties are very well designed to sort of, they fit well under the toilet. So if you share a toilet with somebody who stands to urinate, or if you just need something out of the way, but to come out for you when you sit down on the toilet, they're wonderful. You can get them now in mahogany or lucite. A little boy that I was working with got very excited when he saw that there was one that had superheroes on it. He put it on his Santa Claus request. His mom said to me, I think Santa might have gotten it first. Has he ever been asked for a squatty potty before? But so there's one, or you can get the white plastic one. And when people have said to me, I don't want to have one in my bathroom because then everybody will know that I have problems. I try to say, then everybody will know that you're enlightened, because a squatty potty is like everybody should get themselves into this position. It's how we're designed. So a lot of people have pain in their pelvic floor, and I won't really, it's a complicated topic, but it can arise just from pelvic floor muscle tension. You can have pain. A lot of people I see are quick fixes because all they need to learn is to release their pelvic floor. But pelvic floor pain can arise from all kinds of things, including emotional distress and trauma, but also these more common things, hormones and hemorrhoids and injury. And pain with sex is sometimes an issue of pelvic floor muscles that don't relax, or that people have not achieved being aroused before they have sexual contact. But also some people have hormone considerations that contribute to their pain with sex, a history of injury. They might need lubricants. They may need just to be reassured and feel safe. So the flip side of that is the relationship between sex and pelvic floor muscles is that people who have good pelvic floor muscle awareness and ability to relax and ability to contract report enhanced sexual experience. And so there's advantages there too to learning some of this. So pelvic floor muscles and your ability to enhance the way they work for you starts with tension awareness, just seeing if you can tell, even as you're sitting there now, and we've been having this conversation a little bit. Can you tell where you are on the dial? Does your pelvic floor default to a tense setting? Or is it somewhere lower on the register? And shall we make sure that you know how to strengthen your pelvic floor? And that's where we're going to go next. I'm Canadian, so I'm fond of this photo of physiotherapy, because that's what we call what I do in Canada. So when I work with people who have a weak pelvic floor, one of the things that I firmly believe, I have to say it's not substantiated by research, but nobody's done the research that I want them to do on this, is I believe sometimes people need to start by doing it lying down. Like, lying down is anti-gravity. It's oftentimes the easiest way to know for sure if you are contracting your pelvic floor. And so I work with people who are lying down to start with, and then to sitting, and then to standing. That's my preference. It was reinforced by a woman that I met who came to me many years ago now and was really annoyed that she had to come see me. She was going to have bladder surgery, and her urologist said she had to see me first, and she was very hostile. And she said to me fiercely, "I have been doing Kegels longer than you have been alive." And she was intimidating. I said, "Well, at least if you get better, we'll know it's not a placebo effect." But she had been doing Kegels, air quotes, in the grocery store, as her obstetrician had told her to do, for 60 years. But I think she never really was doing the right muscle. She wasn't doing the right thing, and probably she started out weak. And for 60 years, I think she had been tightening her gluteal muscles, and she did not have a strong pelvic floor. So we started lying down, and then we got her sitting, and then we got her standing, and she did not need her surgery. And she brought me some plum jam and said, "I knew from the first moment I met you that you were going to be a wonderful addition to my life." And I think of her all the time when I start people this way. So when we're strengthening a muscle, one of the things that's important to do to make sure you're doing a thorough job is to do some short contractions. So with that pelvic floor exercise that you tried, can you just do it on, off, on, off, on, off repeatedly, maybe 10 times. And then maybe 5 times, see if you can hold it for up to 10 seconds. Some people would say longer than that, but I like to recommend that people do 5 sets of just 10 seconds. And so you may find, "Oh, yeah, I'm fine. I can do these short ones." And then when you start doing a hold, it tapers away even as you are commanding it to hold. It's the same muscles, but different fibers in the muscle, and we need to operate. We need to be able to operate both during the course of our day, and so we need to exercise both. It's also really important that you let go after you contract, because we're not trying to generate the resting frown face of your pelvic floor. Most of the research on strengthening a pelvic floor recommends that 3 times a day you do 10 short ones and 5 sustained ones. That's what's, that's what's mostly seen in the research. There are some apps that are out there. The National Health Service of Britain produced something called the Squeezy app, which used to be free. I think it's now $3, and it will remind you and take you through a little session, however many times a day you want it. And then we want to integrate pelvic floor muscles into your daily activity and in other exercise that you do. So a lot of people that I work with are then going on to Pilates classes, yoga classes, running, jumping, weightlifting, whatever. We want to make sure that your pelvic floor knows to show up. And that is the quick version of what I think everybody should know about their pelvic floor. And I just want to say, on average, people have pelvic floor distress for about 6 years before they ever mention it to their physician. I'm trying to work with physicians to encourage them to ask everybody, not just elders, but 20-year-olds and whatever. And so I put this slide in here. This was me in June. I am a human being who does not like heights. I do not like risks, but I got talked into doing rappelling. And I want to say there are scarier things than talking about your pelvic floor. So thank you for being here this evening. I hope that was helpful. I'd love to hear your questions. And I think Rebecca and I are going to talk a little bit, and I will switch over to the blue chair. Come to the blue chair. Thank you.
So is this on? Yeah? Good. Well, thank you.
You're welcome.
Everything I never knew
I'm
about
so
pelvic floor
glad.
muscles. So how many of you, so just if you're willing to reveal these giants, how many of you have had discussions with your primary care person about your pelvic floor? Good.
Did you have to bring it up, or did your doctor or other provider bring it up? You brought
it up. Yeah.
Go you.
Yeah. I asked Peg to do this because my daughter's mother-in-law discovered, as many women now are, older women, that they're dealing with prolapse. Mm-hmm. Nobody had ever said anything to them way back when about, delivered 3 big babies, and I don't think anybody ever said anything about building their muscles back. And so she was in a very difficult place and trying to figure out what could be done about it. And I ran into Peg to ask her that. And then I thought, oh, maybe other people would be interested in knowing this. So that's why Peg's here, is because I wanted to hear her thoughts about this. But I am discovering many people I know, as they've gotten older, are dealing with incontinence and other things that they had no readiness for or no knowledge of. So I think it's a great opportunity for us to learn about this. So how did you discover that you wanted to do this particular kind of therapy?
Well, I received a flyer in the mail about being trained for this in 1989, and I showed it to my spouse and said, this is something I have no interest in doing. And that was on a Friday, and the following Monday, my boss came towards me with the same flyer and said, we're registering you for this course. And she was not someone to whom you said, no, thank you, I'm not interested. And so I did, and I am eternally grateful to her, because it is the best match for me as a physical therapist, because I care about it and I'm comfortable. I think it suits my personality. I have a little bit of a crazy sense of humor, and so I'll meet people ideally, hopefully, wherever they are, and it means so much to people. I see a lot of people who, are just embarrassed because they pass gas without meaning to. They can't go out to social events because they can't trust their bowel or bladder, or they feel like their relationships are unsteady because they can't be sexual comfortably without pain, or they're being sexual and it's miserable. So all the things that are so important to our sense of self. And so I love it, and I am grateful to my boss for telling me I needed to be the one who did it.
Well, and I actually, when I first said to Peg, well, does this have anything to do with men too? Showing you how much I understood about anatomy. And she said, oh, absolutely, it applies to men and women. I was impressed that you said people with penises and people with whoever owns whichever equipment they've got, that this applies.
It's important for us to do that. I see lots of people who are across the gender spectrum and trans and non-binary, and we need to use the right terms.
Yeah. So we have time. Are there questions? Come ask questions, because my guess is that most of us don't know or didn't know much about this before coming. And so what kinds of questions do you have? And if you do, you need to come to the mic, because this is going to be archived. It's going to be on there, on the YouTube channel eventually. Questions? Everything you've ever wanted to know was just covered in 45 minutes. And any question? Yeah, Mike. Mike, can you come up to the?
Is it possible to ask a question without being up on the mic?
It's personal.
I don't want my face.
Right.
Okay.
You don't want to be identified.
You know what? Ask your question.
Ask your question.
Ask your question.
And I'll repeat it if.
Okay.
Yeah.
We've been talking about pelvic floor muscles, but we haven't talked about sphincters. And if I'm working at an interesting problem at my desk, I can work until my bladder is feeling like it's going to explode, and still I can continue working and then go to the bathroom, fine. The same at night, no problem. But if I go into the kitchen and I'm washing dishes, or I'm slicing vegetables, or I've got a bread dough on my hands, then I just feel, I describe it to myself, because I've never talked about this with friends, as wetting of my urethra. There's no sphincter on the bladder screaming, I'm full. It's just wetting, and it's around washing dishes, or even, ironically, I've done some web research about, they have a technical term for it, a secondary urination after, particularly.
A post-void dribble, maybe?
They recommend post bowel movement, a second urination. But I don't understand what's going on, that I can hold it in these.
Yeah.
And it's a different dynamic.
Isn't that fascinating? Yeah.
One is with the sphincter and the full bladder. The other is I'm just washing dishes and
There's a few things about that. So the sphincters will close with the muscles. So I don't want to have I want to make sure that it's clear that your sphincters are part of the muscular system. There's a number of things that can happen for people. One is when we're sitting, as some of you might have discovered if you tried standing, For a lot of people, it's much harder to contract your pelvic floor effectively when you're standing than it is when you're sitting. And so when you're sitting, you may have some counter pressure from the chair that's helping you stay continent, where when you're standing, there's not. We don't fully understand this fascinating phenomenon of, like, when you hear the sound of water, or when you feel water. For some people, it becomes sort of a Pavlovian thing. It's like, uh-oh, here's that trigger for me, and now I expect it, and now I'm anxious about it, and now I'm worried that it's going to happen, and lo and behold, it does. Sometimes what people, I'll suggest, go to the bathroom before you start doing your cooking, and make sure, and people need to just really relax when they get to the toilet. And we recommend that people with a penis sit down to pee if they really want to empty all the way, because some people don't. It's a better emptying mechanism, and I know in some parts of Europe they're trying to make toilets situated so that you can't actually stand. There's a cabinet there or whatever, so that people will sit down, because and it's not just the women who have to clean around the toilet, who are trying to get men to do that. But so one question is, does one go to the kitchen and start preparing food with a fully emptied bladder? Is it that when I'm standing, I'm triggered, or is it that when I'm standing, my pelvic floor is not strong enough to close and create that? But that's one of those situations where if you can feel it starting, it's hard if you're just leaking, if it's just seeping out, and that happens for some people. And that happens more if there's a bladder irritant, if somebody has had a lot of coffee or whatever, and the bladder is just like, I'm gonna get rid of this stuff now. But if you can train yourself to contract well in standing, it may be easier. So yeah, that's an annoying thing. I know a lot of people are quite annoyed by that.
Can you come to the mic?
People don't want to. That's okay. I mean, I can understand that. Yeah.
Two questions. One is, can you talk a little to perimenopause and prolapse?
Perimenopause and prolapse. Yes.
Yeah, and then the other one is, are there things that we do that inadvertently makes the prolapse worse? Like, I want to do strength training, but I don't know how to start it because I don't want to make it worse.
Great. So prolapse is a condition that can be the bladder descending down towards a vaginal opening, can be the uterus descending down towards the vaginal opening, or can be the rectal part of the lower part of the rectum descending into the vaginal opening. There's three opportunities for prolapse, and the fact that there is a vaginal opening. One of the things that happens with perimenopause is that the tissues, the vaginal wall tissues, which are normally quite spongy because of estrogen, as estrogen diminishes, those tissues get thinner and less supportive. And we even have, we've learned that the pelvic floor muscles also have some estrogen, or the connective tissue around there also has some estrogen. So as estrogen leaves the body, the tissues can get droopier. And some people are helped by using topical estrogen, which is not absorbed systemically and is safe and is not associated with increased risk of cancer. So topical estrogen can be a big help. When the structures, the organs start to prolapse a little bit, it can be very helpful to make sure that the pelvic floor is strong and supportive below. I think of it being like bread dough. Like if you just hold the bread dough from above, it's going to slowly descend. But if you can hold it from below, then you can really support. And so the question about does exercise, how do we exercise safely? The important thing is to make sure that when you're activating your abdominal muscles, that you're really doing this concept of core, and that pelvic floor is the first responder and the last to leave. So pelvic floor turns on as soon as abdominal muscles turn on, or just ahead of it. and doesn't turn off until abdominal muscles stop. And there are ways to learn to perceive that in yourself. Yeah, and so some people use, vaginal weights and things like that. I'm not a big fan of that because I prefer that it be a more dynamic thing. But I think it's really important not to load the abdominals or the whole body more than your pelvic floor muscle can respond to. Yeah.
We have some questions.
Yeah.
This first one is sort of similar to that. When I do the exercise you described, I often don't feel the pelvic floor relax. I can tighten it again, so I assume it is relaxing. Any idea of what's up? Also, can you talk about how the pelvic floor muscles might contribute to lower back pain?
Great. Yes. So I'll go in reverse order there. So the reason that pelvic floor muscles, if they're in distress, it's kind of like, imagine a searchlight that can go any number of places, and pelvic floor muscles can beam pain to low back. So sometimes when we feel lower abdominal pain or low back pain, it's actually because the pelvic floor muscles are in distress. So that's a common thing, and that's a great question that I would love to think a little bit more about. But the idea of that you don't feel your pelvic floor muscles relax, but then when you go to contract them again, they are contracting. And I think it's great to just see if you can start to feel that slope away. But also, one of the things it'll do with people sometimes is to have you do like a cat and a cow, the cat-cow exercise, that when you're in the cat and your back is arched, oftentimes your pelvic floor is kind of gripping. And when you go into the cow, the pelvic floor relaxes, and it's like your sit bones kind of move apart from each other. And so to start to get familiar with the excursion of a pelvic floor, or to feel just a gentle bearing down and then a springing up, and I oftentimes try to encourage people to sort of feel, it's almost like a pendulum swing, like, can you feel it contract? Can you feel it pass through normal or sort of basic relaxed, and then bulge down a little bit and sort of feel that relaxed, so that your brain just gets accustomed to perceiving where it is. So I hope that's helpful. Yeah. Were there other questions?
Yeah. I can't see you.
Hi.
But Peg, I know you from being a medical provider. in the
Hi.
community.
Yes, it's so nice to see you.
And my question is, from an employer standpoint, we had a lovely pelvic floor specialist in my clinic, and then during COVID, she left. And there's a big void in my practice because it was such a lovely piece to offer the community.
Yeah.
And so and you guys are not easy to come by. So I've been
Right.
looking for
Right.
another, but not just for myself as an employer, because that's a shameless question, but for the audience too. I know that you can talk to your physician, but physicians often don't know who to refer to. So can you give us some resources, some ideas, both
Yes.
from an selfishly
Yeah.
as an employer,
Yeah.
but also
Yeah.
if we were looking for a pelvic floor
This
specialist?
is Molly, who's an OT. She's wonderful. So we've talked a lot over the years. So it's a hard one. I feel protective of people because there's so much misinformation out there, and there's so much entrepreneurial, people selling things in their program and whatnot that I think is not entirely reliable. So in terms of finding, not for you necessarily, Molly, for finding someone to come join your team, but if you're looking for a pelvic health physical therapist, the American Physical Therapy Association has a website, and you can go to it and click find a PT option, and put in your zip code and how far you're willing to travel and what the specialty is that you're looking for. So that's a way to find pelvic therapists if you want to find a physical therapist who does what I do. I wish I knew of. I really should. That's such a great question, Molly, and I think there are a lot of people who have online programs. I just don't know that I have looked to see that I endorse everything that's said? It's such a good question, and I should be better prepared to answer it, but I'm not. Part of the problem is that a lot of what I see online speaks to a person who might have a certain kind of presentation, but not every presentation, you know? I mean, I see postpartum people, sometimes they've had a huge tear, sometimes they haven't. Sometimes they've had a cesarean. Sometimes it's like, what did you start with? Are you an athlete who already knows how to find your pelvic floor? Are you somebody who's had sexual trauma and has really checked out from your pelvic floor? So there's just so many variables in who the humans are that it's hard to just say, here's an online way to do that. I feel like I need to have a better answer.
I was hoping you would discuss the connection between the diaphragm and the pelvic floor.
Sure.
Breathing system.
Sure. So the diaphragm is both a membrane and a muscle that is attached all the way the underside of your rib cage. And it separates your guts from your lungs, essentially. And what happens when a diaphragm is doing its job, so when it's at rest, it's dome-shaped, and the guts are up, kind of nestled up against it. And when it contracts, what it does is to flatten. And essentially what that does is create a vacuum for air to go into your lungs. But there isn't a space reserved for it to do that. So in order for your diaphragm to contract and flatten, your viscera have to move out of the way. And your viscera can only move out of the way if your abdominal muscles relax a little bit. And so what we have is like a descent of the internal organs, and your abdominal wall ideally accommodates that, and your pelvic floor ideally accommodates that too. So a body at rest, oftentimes what we'll see is on the in-breath, the belly expands a little bit and the pelvic floor descends and lengthens a little bit, and on the out-breath, they both kind of rebound. So for some people, they can feel their pelvic floor activate more on an out-breath as they're kind of assisting everything to go back up, and the diaphragm is returning to location. But we want to be able to teach people to let their pelvic floor expand or rebound, whether it's an in-breath or an out-breath. The idea of the core that you hear about in the fitness world is that the diaphragm is providing a stable top to this core, where the pelvic floor is providing tension from below. The diaphragm is providing tension above. The abdominals are providing tension from the front, and the spinal muscles are operating too, so that we have this kind of stabilizing force, so that then you can do heavy things with your arms and your legs. And so the diaphragm is part of that whole system.
And so we should be consciously engaging our pelvic floor when we exhale?
If you are that's one helpful thing for a lot of people is to be as they're feeling excursion. When I'm just starting with somebody, sometimes I'll just have them lie on their back with their legs over a pillow and just say, can you feel that on the in-breath, your belly enlarges and your pelvic floor sort of accommodates, and then on the out-breath that it rebounds. And now can you feel that you intentionally send your pelvic floor up, closing with the out-breath, and that's part of the motion of the diaphragm too.
That would naturally lead to so much strength in your pelvic floor because you're using it with every breath. But I can't imagine really doing that, because of course that would mean it's subconscious.
Right. No, you can't do that with every breath. But it can be a way to sort of harness the motion of the pelvic floor intentionally, and it can become part of a strengthening program. The inverse of that, just to follow that, and I do see your question. So to follow that, when I see people, that generation of people who, I think we fortunately don't have as much of it anymore, but very elegant people who keep their abdominal wall very tight so that they appear to have a very flat stomach. If there is no excursion, their pelvic floor is just going to be oftentimes pressed down upon. And so we want to get all of that able to move with, with the breath. And so, yeah, it's a fabulous system. It's a fabulous interconnected system. And so you can imagine people who live with panic and don't breathe, they breathe with their accessory muscles instead of their diaphragm. That changes everything up for a pelvic floor. So you had a question, yeah?
Yeah, I was along those lines of the diaphragm and breathing, and I heard hyperpressives is a way of supporting the pelvic floor. Is that a thing?
It's a thing. It's a very hypopressive is a new thing. It's that way of breathing that sucks in your stomach so much, and all the pressure goes up and away from the pelvic floor. And there are devotees of that. I have just been looking at research about that, and it's very little substantiation for it. So, but I know there's people who are huge fans of it, so I will just say that much.
Do we have other questions from?
I think you've covered what we have.
Good,
Great.
good.
Great.
So, how is our time?
I think we're about out of time.
Yeah. Any other questions before we finish? I'm so glad you've all come, and I'm glad that there's questions that have been helpful, and information that, thank you for that. I'm
So
impressed
fun.
that you're rappelling off a cliff.
So terrifying. But I lived. There you go.
Well, I was
Yeah.
also just thinking, about how we train little kids to pee
Mm-hmm.
with the water on. I mean, that becomes kind of a lifetime of the water goes on and suddenly, it's a tricky one.
Tickling your low back. Yeah. But we have children who have tight pelvic floors and pelvic floor disorders, and part of that is, is sitting on a toilet and your legs don't come down to the ground and your pelvic floor can't relax. And now sometimes with toilets that flush automatically when a small person's sitting on it, that's pretty terrifying. And so we have a lot of young people with tense pelvic floors.
Thank you so much for coming. Say one last thing, which is that our event in December will be on December 12th. Misha Burson, who is the former drama critic for the Seattle Times, has invited 3 directors of Seattle theaters to come and talk about the upcoming season and about what's going on in theater in Seattle. So do put it down. It will be on the website for Town Hall. It will be on my bulletin as well. So again, thank you for coming out in the cold and the dark, and hopefully you learned some good things and you're going to be practicing. Think of that closing flower and opening flower. I love that. I'm all for that.
Thanks, everybody.
Thanks so much.